let's move forward and talk a little bit about the experiments you conducted with the green tea extract combination.
Okay.
You tested several cancers, but since our focus today is melanoma, could you tell us a little bit about your results with the green tea combination against the melanoma cancer cell lines?
Sure thing. We tested 4 melanoma cell lines because we know the melanoma carries different genetic mutations in them. There are subtypes of melanomas. So we used the 4 cell lines to represent some of the most common gene mutations. So one is called BRAF mutation. The other one is called the RAS mutation. And then the other one is P53 mutation. So these 4 cell lines, they either carry one or the combination of the mutations there. And then we found that the Uncle Tea, that's the green tea product we used, can kill like the cells, doesn't matter they carry the mutation or not. Now, current treatment for melanoma, a lot of targeted therapy, what we call targeted therapy, they target the BRAF mutation, which are like about half of the patients have BRAF mutation. But for the BRAF wild type, who's not BRAF not mutated melanoma, those therapies doesn't work well. And then for the green tea, surprisingly, they work on both. So they work on either BRAF wild type or the BRAF mutated melanoma cells. So that's something that is exciting for me.
That is exciting. And
Right.
you found that the green tea extract inhibited the proliferation of all these melanoma cancer lines.
That's right.
Well, let's shift then to our major focus today, which is the potential of the yellow leaf ginkgo extract for melanoma. I think this can be described as a different approach. Could you comment a little bit about how this got started and your thoughts about how you took the experiments that you initiated?
Well, we discussed, John, you discussed with me about Dr. Belzinski's experiments on the RNase, which is an enzyme that degrades RNA in the cell. That is significantly going up in some cancer patients, right? Melanoma cancer patients. And then we're wondering whether the ginkgo product, the ginkgo leaf extract, golden leaf, can inhibit those RNAs. So then we are thinking about whether they are reducing these enzymes that the cancer cells secrete. Some of the enzymes are helping them to grow. Some are like angiogenin. Some of them will help like cancer-related blood vessels to form, right, to supply the cancer with new nutrients there. So if we inhibit those enzymes that is doing this, that will from another angle, you could inhibit the tumor. So we go ahead to test whether this product inhibit the total activity of these kind of enzymes. They're called RNase. Importantly, there are two enzymes we think is of very much interest. One is called DROSA, who control the microRNA production in the melanoma cell. And then there's another protein called angiogenin, which is secreted and basically works as a growth factor for the melanoma cells. So we found that the ginkgo leaf extract will inhibit both of it. We're on the way of trying to quantify it, to see the significance of it, and to see what it is mean for the tumor inhibition.
What is a takeaway? Why should they be excited about this research and could not wait to see the publication that is coming out? How is this is going to help them in their fight for cancer?
I think overall, there are a lot of interests in using natural products and then products from plants. And then first of all, a lot of them are used as folk medicines or in the integrative medicine field as anti-cancer. So my hope is these products, first of all, they are not toxic. Unlike most of the treatment, unlike most of the chemotherapy and radiation therapy. So hopefully they have much less toxicity. And then very well tolerance. And then another way, so if this is working, it produces a mechanism that will be additive to the standard therapy, because those kill cancer cells, and this can like inhibition new blood vessel formation, or it can inhibit the some other activities of the tumor cell, like inhibit their movement, their metastatic potential and other things. So they can be complementary.
I understand well you are saying that it is increasing the capacity of the cell to fight the cancer by itself, and also decreasing the cancer itself to grow by being fed.
So what I'm saying here is that on one hand, we see some of those critical enzymes going down, which normally will help the cancer cell to grow, will help them to get new nutrition. And on the other hand, we see this one RNS going up, which is an indicator for us. The crisis is there because the cell upregulate this specific enzyme to deal with it.
But this would be another beneficial effect. Am I right? If it holds up.
Right, if the stress holds up, and then, yeah.
I will have a last question. Based on both the research that you have done on the tea and now on the ginkgo, what would you think of a preparation that would combine both ingredients?
Preparation, you mean combine the tea, ginkgo, and
The tea and the ginkgo, yes, because we are thinking of doing a topical approach, a cream that would contain both green tea and the ginkgo extract.
With the tea, there are a lot of mechanisms studied with general green tea product, the EGCG and all that. It's antioxidant. It does a lot of things to inhibit cancer. What I can see is probably yes. I think it might be beneficial because if you're targeting the cancer cell from two different angles, they complement with each other. You probably have better effect.
Thank you.
Sure thing. Thank you.